Oops. Well, good evening, everyone, and welcome to our third Q&A session. In addition to Emily, Jill, and Joan Bravo, we're joined this evening by our board president, Dr. Joseph Lin, and one of our board members, Dr. Ram Subramanian, and they're going to be talking to you shortly with a medical update and answer some medical questions for you. Before they do that, Jill, Emily, and I wanted to give you an update from our vantage points. First of all, welcome everyone, and we're glad that you're here with us. Once again, we want to welcome those members of our community who are returning to us from last year, and also those members of the community who are new to Chandler. We're glad that you're all here. We know this is a challenging time, but we're apart, but we're all part of the Chandler community, and we're glad that you're here. Thank you to those of you who responded to the survey that was sent out last week. We had 234 responses from our parent body, and the question, when Chandler reopens, will your children return to campus for in-person learning? 73% of you responded that you would return for in-person learning when Chandler reopens. 7.69% said that you wouldn't, and 19.3% were in the other category. You were wavering a bit and wanting to look at how the situation evolves over the next few weeks before you make a determination about whether you'd be returning to a school. Just an update on the waiver process. It came up during the last call. LA County and Pasadena are not issuing waivers at present. In order for schools to reopen, generally the positivity rate, the case rate, needs to come down to 100 cases per 100,000 population. And waivers will be considered when the case rate gets to 200 per 100,000. Right now, based on data that was shared earlier this afternoon by LA County, the case rate is at 329 per 100,000. So in order for the waivers to be, in order for us to begin to apply for a waiver, the numbers have to come down, the data has to come down quite significantly. So neither LA County or Pasadena's health department has set up the process for applying for a waiver because the rates of infection are still so high. So now I'll hand over to Emily, and from there to Jill. Emily?
Thanks. Good evening, everyone. Thank you again for joining us. If you've been on these calls or in touch with me, then of course some of what I'll share is a bit of a refresher for what's already been shared. But we continue to be hard at work developing lower school programming that is able to move seamlessly between a number of scenarios this year. So knowing that we're beginning the year in distance learning, we're really focusing on the power of relationships as well as predictability and consistency to guide us. Really taking a cue from Dr. Tina Payne-Bryson, who I know many of you have seen speak, to make sure that children are feeling safe, seen, soothed when they show up online, and ultimately secure during the school day. We're currently in the process of finalizing class placement for our 18 cohorts. That's, of course, an increase from our traditional 12 classrooms, focusing on relationships and developing those class lists to make sure that students are engaged and empowered when they're in virtual spaces. Teachers are also busy, not taking too much of a break this summer, working in professional development and preparing to do so for back to school meetings, engaging in workshops really around fostering connection online, incorporating play into virtual spaces, promoting opportunity for students to build more agency, resilience, independence, and a lot of work on wayfinding. And what I mean by that is really this idea of being able to navigate in a new environment with more independence, hopefully giving you a bit of some relief as we have the program evolve a bit, and then leveraging tools like Google Sites and Google Classroom to aid in communication. Similarly, we're finalizing our schedules, which I've shared before consist of alternating times between synchronous online learning experiences, as well as independent breaks really for asynchronous work, physical activity, rest, and of course, more play, which we know is really the work of children, so we want to focus on that. We're fortunate to be able to offer the full scope of our program, even in distance learning, instruction in all core subject areas, daily PE, specialist courses, Spanish, science, art, and music, along with new additions of social and emotional learning courses and digital citizenship courses. And while the schedule does have, even in distance learning, sort of a regular bookend, 8 to 2 for kindergarten through second grade, 8 to 3 for third through fifth grade, we are being very mindful of what is developmentally appropriate for screen time and looking for opportunities to provide families who need more time on device or more time alongside teacher that, and those who need less, a way to scale back. So I'm really eager to share more details with you next week during our parent forums, which I'm hosting in the evenings, Monday through Thursday next week. But of course, if you cannot attend or if you have other specific questions, please be in touch. In these days where I'm not able to connect with many people, it's really been such a joy to connect with so many of you online, to see you on some Zoom. So truly be in touch if there's anything that I can do, and I look forward to partnering with you as we continue on this kind of crazy distance learning adventure. So thank you. I'll be happy to answer questions as we continue this evening. And Jill.
Thank you. So it's really great to have so many of you here tonight. I'm just coming back online from a much needed disconnect from technology. So as I say this, bear in mind that I'm working my way through my inbox, and I'm also working with the faculty as well to kind of iron out everything that we want to solidify before the start of the school year. Like Emily said, you know, we're still able to offer the full slate of our program, including PE and art and music while we're in distance learning, and that we're going to be adding mindfulness and social emotional learning to our PE curriculum. I know those will also be courses in the lower school as well, so it's nice to know that there will be a broad, holistic education for our students. What I would say is the cohorts have been decided, that it's partially been based on Spanish levels, so that we continue to challenge our students in that area and meet their needs as well. That our schedule has been ironed out, and that core classes will meet on Mondays, Tuesdays, Thursdays, and Fridays. And we will use Wednesday as a wellness day. So things like advisory and student activities and independent work and office hours as well. So that students can really kind of ramp up and then take a break and come back. One of the things that we will be considering every day and every week will be the screen time that our students have. You know, it's a very tenuous balance that we have to orchestrate, because while we want our students to feel connected and we want there to be social and emotional support and a sense of belongingness and relationship for our students, we also want to be mindful of how much time our kids are spending in front of screens. And for the middle school, probably much like the lower school, there's both synchronous and asynchronous content that takes place. And in the middle school, all of that basically takes place on a laptop. So because that's the case, if our students are not getting off the laptop during asynchronous content, we need to take that into account as they move through the entirety of their day. So while you might not see a lot of live Zoom sessions, we know at the same time that our kids are still in front of the screen. And that's really the trade-off between in-person learning and distance learning, and something that we want to be mindful of as we move through this. Like Emily said, I'll be having parent forums next week, and I look forward to talking with all of the grade levels. I look forward to welcoming our new parents and families. And for our 8th grade families, I'm happy to answer questions about what the high school admissions process will look like this year. We've been getting quite a bit of information from our admission directors in the local high schools, and I have a bit to share out with you. And I think that basically sums up where we are at this point.
Great, thanks Jill, thanks Emily. If you have questions for us, please put them into the chat, and Joan Bravo, our moderator, will communicate them to us. But now we'll turn it over to our two doctors, Dr. Joseph Lin, our board president, and Dr. Ram Subramanian. Joe?
Thanks, John, for having me here, and wanted to say hi to everybody. Thanks for joining us this evening. As John mentioned, I'm chair of the board of trustees, but also a parent here at the school and an oculoplastic surgeon as well. I also chair the Chandler Medical Advisory Group, which is comprised of medical doctors and a USC epidemiologist to help advise Chandler on reopening plans. John asked us to join you this evening to update you on some of the topics that we are covering in our medical advisory group meetings, especially in light of much of the media, well, the recent media reports of COVID infections with children. I'm joined here with Dr. Ram Subramanian, who, as John mentioned, is also a Chandler trustee, and he serves on this medical advisory group as well. Ram is a pediatric cardiothoracic surgeon at Children's Hospital of Los Angeles. In this capacity, he has firsthand knowledge of caring for children with COVID. He's part of the COVID surgical task force at CHLA and resumption task force at the Health Sciences campus of USC. These roles provide him an opportunity to review the scientific data and papers related to COVID, particularly in regards to children. He also helps generate current practice guidelines at CHLA and USC. So we're lucky to have him advising the school. And we thought it'd be useful for him to share some of his expertise and review some of the data that he's seeing. Afterwards, we're happy to take questions. Ram?
Thank you again. Hello, and thank you for joining us today. And I want to start off by thanking Joe Lin, our president, for the leadership that he's shown in these difficult times. And equally importantly, I want to thank John and the wonderful work that the school has done as we wade through these decisions and changes that we need moving forward. So like Joe mentioned, the objective of the medical group was primarily to advise the school and to drive consensus in order to work out best practices for when the school reopens. For example, we helped design a protocol for the screening, isolation, and return to school of both staff, students, and faculty. Another important role of the medical advisory group has been to sort through the available data. And why is that important? The reason that's important is because media has been publishing a lot about school and COVID and coming back, but there's a primary data behind this media hype, which provides us more detailed information. And the medical group has been able to use our personal experience and expertise in sorting through these data so we can come up with reasonable principles for carrying forward in the school. So what are those guiding principles we worked with? The most important thing we decided was that any decision we do will be data-driven. We're not going to go based on either fear or our own personal bias, but primarily by data. And we're going to put safety first. What that means is that every time we're evaluating the risk-benefit ratio of coming back to school, as someone very nicely put it this morning, we're learning to live with the virus in existence. I think an expectation that the pandemic is going to be over at the blow of a whistle and then we're going to restart school is unrealistic. We're going to learn to live with the virus around us to try and see how best we can mitigate the risk of the infection and enhance the benefit of social and emotional well-being when the school reopens. So, in that regard, what are some of the important data that we know about children? What are important caveats of the data that are coming out? An important caveat to know is that not all states report data on children. New York, for example, does not separate out data on children. The age range definition of children varies from state to state. Some states report children as 0 to 14 years of age. Other states go all the way 0 through 21. And you'll see why that's important in a second. What we do know is that children seem to be affected differently by COVID. There is a non-linear relationship between children testing positive to demonstrating signs of infection, to requiring hospitalization or having complications like ventilatory support or death. That's not a linear number. That is, even though there are people who may test positive, the number of children who have been hospitalized from COVID after testing positive is in the single digit. as low as 0.3 to as high as 8.5 to 9%. So testing positive doesn't directly translate into disease requiring hospitalization, which is, a good thing. Similarly, there are very few reports of children being primary carriers of the disease. That is, an adult passing it to a child and then the child taking it and passing it on to a separate adult. That kind of a vector transmission, while some reports exist, they are very, very, very few and far in between. This is particularly true for children from the 0 to 10 years of age, maybe even up to 12. But the adolescents and the older children tend to act a little bit more like adults. Fortunately, for a school like ours, which is K through 8, some of the data that come from high schools are not directly relevant. Yet, there are some sobering truths that we need to face. There are countries like Denmark, Belgium, Quebec, and Canada that open schools very successfully. It's not been the case in states like Georgia in the United States. The latest report by the American Association of Pediatrics noted a 90% increase in positive tests in children in the last 4 weeks. Currently, it's anticipated that about 501 per 100,000 children have tested positive for COVID. And again, like we saw in adults, certain low socioeconomic groups and certain racial and ethnic groups seem to be at higher risk. What we do know for sure, at least based on the Georgia experience, is that if we decide to resume school in a very careless and haphazard fashion, we will pay a price. There will be an increase in positivity, there will be an increase in infection rates, and quite honestly, even one bad outcome is one bad outcome too many. So, the school has prepared itself, and we've discussed this with the medical advisory group, on the school's readiness to tackle some of these questions when we come back. I'm sure those will be discussed in another forum, but suffice it to say that with the medical advice that the group has provided to the school, we've looked at things like best hygiene practices, use of masks, ventilation, how to cohort children, how to allow a hybrid model, because like John says, the school can't be everything to everybody. So allowing people that can come while at the same time protecting the more vulnerable groups or high-risk population and allowing them to be part of the Chandler educational community without having to be in person. And how are we going to screen, contact trace, and allow people to come back to school? These kinds of decisions are being made on a continuous basis by the medical advisory group. So that's sort of where all the data are right now. There are very promising things to be looking forward to with respect to children's infection, but we're very careful. So if I were to summarize, I think as long as the infection rate continues to be high in the community, we cannot, but certainly we will not reopen the school under those circumstances, because I believe that would unnecessarily increase the risk of infection. And ultimately, a big part of the decision to reopen will be prescribed to us by some of the authorities, such as the California Department of Public Health. We're closely following the risk-benefit calculation ratio. We're being deliberate and intentional to balance the academic and social emotional well-being with the health and safety of not just our students, faculty, staff, but also the larger Chandler community, which includes parents and families. And like Barbara Frere has been saying, we continue to be cautiously optimistic and closely following the situation. I'll stop there. Back to you, Joe, and happy to take any questions.
Thanks, Ram, for that rundown. I appreciate that. And I'm sure everybody else appreciates all the knowledge that you're able to share with us. I know the medical group is. And I wanted to thank those of the medical group that may be out there for all their help and support with sort of wading through a lot of the data that is coming. And it's ever changing. It's not something that's very static, as we can all see. And it can get complicated with some of the media as well. So I'm sure there may be some questions that some folks would like to ask us, and we'll try to do our best to answer them.
Okay, great. So as Mr. Finch had said, The chat is open if you'd like to submit your questions for the panelists this evening. And we're going to try and do the medical related questions first for Dr. Subramanian and Dr. Lin. And one question that we do have for Ram: will Chandler be looking into having the families and staff tested before returning to school? And what are your thoughts about that? If I know the answer is that we won't be doing any regular testing, but maybe the medical and the science behind that reasoning.
Yeah, that's a good question. Whether there's a benefit to mass testing or not is still out in the air, but more importantly, the availability of testing is also a question. What has been prescribed for return to work and return to school, particularly by the CDC and local authorities, is screening at entry. That is self-screening in terms of symptoms and questions of if you have symptoms or exposure, to then go through a working plan is a better strategy at preventing the spread of infection. And that's what the school is going to be following.
Mr. Finch, just to follow up on that question, can you talk a little bit about our intentions of partnering with a lab for future testing, if that's available?
We're still pursuing the idea of retaining a lab to expedite testing when we need it. Right now, the route that we'll take will be through our individual healthcare providers, but it's our intention to secure a lab to help with that process. So we're still working on that, and hopefully we'll be able to report progress at a later date.
Another question about contact tracing. Has Chandler thought about having work with a contact tracing person who works with the school when campus resumes? Mr. Finch, maybe that should be an operation question, and Mr. Finch, could you answer that?
Yeah, we're all contact tracing people at school. I mean, that's going to be a requirement actually by the Pasadena Health Department. Everybody has to be trained in contact tracing as a condition of our reopening. So as yet, Pasadena's Health Department hasn't posted the training requirements at the training course. They were going to design that themselves. But once they do, all of our faculty and staff will be required to take that class as a condition of reopening, which we will do, of course.
And Dr. Subramanian, know that the medical group worked with the school so closely in creating our protocols of, what to do if our students are exposed to a possible case of COVID, or have symptoms of COVID, or have been positively tested for COVID. Can you speak a little bit about that, and in reference to contact tracing as well?
Absolutely. So we've been very intentional and collated data that have come from various sources and ensured that our plan is commensurate with what California and the CDC have recommended. If anything, we've been more cautious and slightly more conservative in our recommendations. So certainly anybody with symptoms will be asked to go back and then get themselves tested. We have a specific plan on what to do if the test comes back positive or negative. We also have a format by which we will identify people who are exposed to someone that was COVID positive and how we'll handle that, and ultimately what we will do when someone is tested COVID positive, and how the cohorting is going to help us trace contacts within the school and what reporting guidelines are required. So suffice it to say that there's been a lot of thought into it, and we're going to be very, very careful and conservative. So safety is always our priority.
There was a question about the data and about children not acting as vectors of the virus, and that while that, they may not transmit it as readily as adults, that it's not an absolute, that they can't. Can you speak a little bit more in depth with that and cite the sources possibly of where that data can be found?
Absolutely. That's a very good question. It is true that no one can be 100% certain that children do not transmit COVID infection. That is, they don't act as vectors. There's very good evidence to suggest that they are not primarily the transmitters of transmitting vectors of the infection. There have been some studies that when a child got positive, the rest of the family also got positive. But the problem with some of those studies is they were all exposed to the same set of people who had tested positive before. So without being dogmatic about it, I can quote what the CDC has also said, and that is, there are few reports of children ever being the primary source of COVID transmission. That's where this recommendation is coming off of. It's possible that they can transmit, which is why we're going to be very, very careful.
What is your opinion, doctors, on the upcoming vaccine? And would you give it to your own child immediately once it was available, or would you not rush to that immediately?
I can take that. So I have faith in the system that safety will be the priority. I'm sure that the FDA and the authorities that are looking at it are going to closely evaluate the vaccine before they release it to the public. I personally, for my children, will be very, very, very willing. In fact, I've volunteered to be one of those testing the vaccine for adults at USC. But in an individual child's case, I think that decision needs to come from the child's primary pediatrician to evaluate the risk-benefit ratio for that particular child.
I'll just add that I echo what Ram is saying. I will say that there's a lot of vaccine candidates out there. We don't know much of the details. There are different types of sort of the way they're setting up and how that will be, some of which the platforms have not been tried before, and rightly so. There's some concern about that. I know from my personal situation, I'll look at it and evaluate it when whatever candidate is available when it comes in. It will be interesting. I think that it initially, although they've ramped up a lot of these vaccines, they're just not enough to be available. They're going to be sort of rationed to frontline workers, health staff, first responders, and we'll have to see how that process will happen, and also how when that gets rolled out, how quickly the response to the vaccine in terms of the immune response will be. We just don't know a lot of these details. And so we should be preparing ourselves, I think Ram said it best, to begin to realize that we have to live with the reality that this was going to be with us for a while. And so I don't anticipate this will be a silver bullet that will be turned on in January if we're able to get a vaccine at that time, and then we'll be back to normal by the spring. We have to be prepared to, it'll be much longer.
Great, thank you. Doctors, what about asymptomatic transmission for students? And you talked, Ram, a little bit about the protocols for when children have symptoms, what we would do. But can you talk a little bit about the asymptomatic students and adults?
Yeah, asymptomatic transmission is a problem. That's why what is very, very critical is hygiene practices. The physical distancing, cohorting, wearing of the masks, frequent hand washing, adequate ventilation in all the rooms. Those are the primary modalities by which asymptomatic transmission can be prevented. And there's good evidence, especially in countries that successfully reopened schools with these physical distancing guidelines in place, that it can be done without an unacceptable increase in the positive rates.
Great. We had some questions about screening. And you talked a little bit about that in terms of symptom screening and also temperature screening. If you could add, we will be doing that daily, and we will have an app that families will be logging into to provide us the information for the symptoms. And maybe the reassurance of why that's important as a process and tool for us to reopen safely.
Yes, screening is primary and crucial because that's the important modality by which we will be able to trace, track, and follow people and be able to triage and say who does or does not require testing, or who can or cannot be exposed within our cohorting. So in any return to school or return to work environment, I think screening is the primary modality to triage how to allow or disallow someone from participating in a group.
Great. There was a question about who the doctors are that are on the medical task force. Dr. Lin, can you share with us who those doctors are?
Sure. They are Dr. Matthew Smith. He heads up a lot of the Southern California emergency room departments for Kaiser. There is Dr. Terry Kim, also internal medicine doctor at Kaiser. There is Violette Gray, Dr. Violette Gray, who represents internal medicine doctor at Cedars Sinai. I think we are lucky. There's also a trustee, Dr. Irvin Kaw, who he's a dentist, but is very plugged in with the Chinese community. There's another trustee, Dr. Wendy Setiawan. She's a USC epidemiologist and has access to much of the data that is coming in from USC. Let me see, Ram, am I missing anybody else? Forgive me if I am.
Pavel Bindra.
Yes.
And Violet Gray.
Yes.
You just mentioned her.
I think that's it.
Yes. Great. Well, thank you. Thank you to those doctors, if you're on the call, for really, really providing us guidance at the school to make some very important and challenging decisions. There's some questions about, a point person on campus, a COVID coordinator, which is what we have. Mr. Finch, can you speak a little bit to that role, to that position, and what they will be doing in service for the school?
Yes, Maureen Short has been appointed our COVID coordinator. She's also our annual fund director, but she's going to be allocating a lot of time to coordinating our COVID response. And she's really making sure that all of our protocols are being followed all the time by everyone in terms of screening and masking and distancing and hygiene measures. She'll also be coordinating our contact tracing. She'll be looking at the data that comes back through our screening app, and she'll be tracking testing for those people who require testing before they return to school after they've left to recuperate if they are symptomatic. So a lot for her to do.
And I'd like to add that, Maureen did take, what was it, a 7-day, 8-day course on COVID training, and also a 2-day course from Johns Hopkins on contact tracing. So she's definitely been doing quite a bit of professional development to get herself ready to prepare for an opening at school. There was a question about using data and HIPAA rules, and I wanted to just say that all of the screening apps that we are using are third-party vendors that are completely HIPAA compliant. We are very mindful and thoughtful about the data that we are collecting on our faculty and also our students, and so we will be very confidential about the information that we receive, and when we need to communicate cases, symptoms, or exposure, we will do so very, quickly, but omitting any type of medical information and names of students in violation of any confidentiality of the students. And that is to address a couple questions about the contact tracing software that we should be downloading for students to use. We are reluctant to implement any of those because there are so many new softwares that are coming up just because of what is happening with COVID, that we're reluctant to just use any vendors, and those actually may not be complying with HIPAA rules, and so we won't be doing that. Additional questions. I'm sorry, Mr. Finch, did you want to say something?
No.
One question is, do you think it would be beneficial to have some scientists on this medical task force, Mr. Lin or Dr. Lin?
I think there is a lot of folks that would be very useful in being on a task force and providing information. Initially, we started off with, and we didn't know the magnitude of what was going to happen. And we were trying to figure out who would be able to advise the school, at least to sort the data clinically, and be helpful to the administration as well as to the board on how to drive data-driven, consensus-driven decisions to make sure that our children were safe. Definitely, I think it can be helpful to have a lot of input from different professionals in the community. There's so many doctors, there's so many scientists. I would say the majority of all the parents in the community are been so kind with their time and their expertise. And I wouldn't say that necessarily that we wouldn't need your assistance. In fact, it would be great if there's any information that you have, you could send it our way, to either Ram or myself. And this group is meant to help sort of be a funnel and filter and sort of put a lens that seems appropriate, and to advise the administration and John in particular how we approach and think about a lot of these specific questions. So at first it started clinically, and it's specific with Wendy as an epidemiologist to sort through the data. As we go forward, maybe it'll be something we'll consider in terms of, I think when you say scientist, like a basic scientist, that may be something that may be worthwhile. But sometimes, I'll be frank, too many cooks in the kitchen can be hard to sort of, we don't want to make it a harder situation to distill information. And I think we have really dedicated, thoughtful folks who have balanced goals and are really pushing to keep our children safe. We don't want to put any of our children in harm's way and make irrational decisions. And I think that is the key message I'd like to get across, at least as a parent, is that I hear from a lot of families want to go back to school, rightfully so. Others have very real concerns about returning to school. And they all have very valid concerns that's particular to their family situation. And I think everybody that I've talked to always care, especially administration, care about the safety of the children and have to balance the risks and the benefits of sending the children back. And so I think the key here is transparency throughout the whole process and communication. And I think John and the administration have tried to do that with so many things, so much information going around. So that's a long-winded answer to the question, but I just wanted to put that out there, that I think there are a lot of hardworking people behind the scenes, and that we are really looking to keep everybody safe, especially our children.
Thank you, Dr. Lin. Dr. Subramanian, can you talk a little bit about masks? There are questions about bandanas and neck gaiters. And, while we have put it out that it is a requirement to return to on campus that we will have to wear masks, what type of masks are the most, effective, and what should parents be purchasing for their students?
Yeah, thank you. So what we do know is, with the evidence, that gaiters, handkerchiefs do not work well as masks. So the minimum requirement would be a physical cloth mask as such that covers the nose and mouth, particularly when speaking, when aerosols are generated. There is definitely evidence that the more surgical masks and N95 masks may be more effective in preventing the spread of the virus, but it appears that they are more relevant in an area where there is higher risk, such as in the hospital or while taking care of a COVID-positive patient. So for the general public, we recommend a cloth mask, not a gaiter or a bandana kind of thing.
Great, thank you. Again, Dr. Subramanian, in symptoms of children, there's some questions about what if my child has underlying issues such as asthma, respiratory issues? What would you advise them in terms of returning to school?
Absolutely. That's a very good question. Underlying pre-existing conditions seem to be modulating how children respond to infestation or any kind of infection by COVID. So I would strongly urge every family to make a decision that is right for them, both socially and medically as prescribed by their pediatrician. No one size is going to fit all. We fully recognize that some children, for a variety of reasons, are at higher risk, and they should be treated as such.
Great. So I think just in the interest of time, I want to move to a couple of other questions that may not be medical related, but if I see some in the chat room, I'll definitely throw some questions back out to you doctors. But there have been questions, let's see, to Jill, if in terms of blended learning options, and if families want to not participate in the in-person learning program, what will be the accommodation for our families that are unable to come on campus?
Sure. John and I had a nice conversation about this today, and I know he talked about this with Emily as well. But really, your family's safety and your family's values are the most important thing right now. And that is what ultimately decides how you feel about your child's education and their well-being. And we know that children can't learn academically if they don't feel safe first. So we want to make sure our children feel safe, and they take their safety cues from their parents. So when you as parents feel safe, your children will feel safe. And when your children feel safe, they'll be able to learn academically. And that might mean coming on campus, and it might mean staying at home. And whatever it is that you decide, we will work to accommodate that. So, you know, I've talked with our teachers in the middle school about having swivels in the classroom so that we can live stream classes. And students may not be with the cohort to which they were assigned, but we will make sure that they get the education that they need. We won't be recording classes in compliance with just privacy for our teachers and respecting the video recordings of them. But we will make all of the education that's available to our students in person available to our students who are remaining at home.
Could I just echo that for the lower school as well? So we also will have programming available that allows your child to remain in the same cohort that they've been in distance learning, should you choose to keep them home when we are able to return in person. So they would have their same teacher, the same teaching assistant, and their same peers in the classroom. We're able to do that because, similar to what Jill described, in grades 3 through 5, we have a one-to-one laptop program. Our teachers are able to utilize that to live stream to students who are at home. And then in kindergarten through 2nd grade, we will also be leveraging the tool that Jill described, Swivel, which is a robot, if you haven't heard me talk about before, on which an iPad sits. Teacher wears a microphone, and it's able to follow and trace the teacher around the classroom. And we have additional microphones available, so when students are on campus, we can also allow students at home to engage with their peers in small group discussions by placing that microphone either on a table or hanging it directly above them in the ceiling. So we will work with your family to accommodate, as Jill said, what your values are, what your comfort level is. We absolutely want to make that work for you.
And just a follow-up question, Emily, you could answer first. How, what can we do so that the students that are at home don't feel kind of outcasted, or they're the others that are staying at home while their peers are able to participate in an in-person program? What can we do to support those students?
Yeah, it's a great question. I think one silver lining of beginning the year in distance learning is that we'll all have a comfort level after we've been in it for some time with engaging with other people on screens and in and out, plus those who have had experience with it just this past spring. Because it's going to be with the same kids, the same teacher, they're also going to be the same cultural norms. So expectations about how people interact with each other, we come to those agreements at the beginning of the school year. How do we want to treat each other? What do we want our classroom to feel like? How do we want to respond when something is difficult? So I think that's really going to be a nice foundation to really help us with that. Again, because we've also created schedules that have a similar rhythm to the day, whether they're in person or away. I think that predictability is really going to be helpful for students because they'll be logging in at the same time, the routine will be the same, the direct instruction will happen at the same time, and they'll already be paired with small groups. So it's something we're going to continue to be mindful of, and please, if we're in that situation, communicate with us so we can adjust as needed. But I think because we'll start with some very clear cultural norms for our kids, it will be a much easier transition than we anticipate.
Jill, would you add to that for the middle school?
I mean, I think Emily has captured it pretty nicely. Every family's social, emotional, and physical health is a priority at Chandler. And to the extent that we are able to support that, we're going to do that on campus. John always says we can't be all things to all people, and we know that. But I would say we have an amazing faculty who is working so diligently this summer to try and be as many things to as many people as possible. And I just really want to give a shout out to all of them, because I've seen the hard work that they have been doing to really bring distance learning to life, and to even get prepared for in-person learning when we are able to return to that.
Thank you. Just speak a little bit more on the social emotional piece. Emily, could you speak a little bit about, the potential of the impact on our kids being on distance learning for such a long period of time? Emily?
Yeah, absolutely. So I was fortunate to attend a roundtable discussion with other heads of lower schools, middle schools, and high schools this past, I guess just yesterday. I was thinking it was a week ago. I have no sense of space and time anymore, but just yesterday. Dr. Tina Payne-Bryson was there, along with a number of other psychologists and pediatricians, speaking about really what signs to look for, should something be a little bit off, and also really the importance of all the adults maintaining their own regulation and how powerful that is going to be in helping our children to stay regulated. So though it can feel counterintuitive, I think that thinking about putting your own oxygen mask on before that of your child is going to be really important for us to constantly be thinking about. And as such, I think what we also need to do, in addition to focusing on connection, is really looking to find these silver linings, bright spots, moments of joy and playfulness. Because when we do that, what the psychologist spoke about is that we're able to really change the neuroception, right? To change this idea of being in sort of chronic fear, chronic fatigue, that can't last when it's up against smiling and laughter and joy and those pieces. And so that's what our teachers are really working on providing within their lessons, lots of games, body breaks, dancing, music, things that are going to be helpful in sustaining their attention. Another thing that I thought was really helpful that they spoke about was doing a sweep, right? And everyone probably has heard a million acronyms, but when you're thinking about your child, and if you're worried if they're having a difficult time or just rather a difficult day, to really think about doing a sweep and checking on these things: their sleep, their workload, their eating habits, their emotions, and their play. And if there's adjustment that can be made to any of those items, then that could be particularly helpful in getting them back on track. Also, we would just really encourage you to always be in communication with your child's teachers, with us, because we want to help you. Please don't let it devolve into a situation that's gone too far down the road. If something feels off, something is challenging, we want to be solutions focused, and we are happy to connect with you, happy to make time.
If I could just add on to that, I've taken a 9-week parenting in place course over this summer that was recommended by Lauren Albrecht, one of our current parents. And I don't know how many of you have taken it alongside me, because there have been thousands of people across the United States who have done it. But I will be sharing out tips from that over the course of the next few weeks through the Cloverleaf. So please look for that, because there have been a lot of good tidbits just about what we can do as parents at home to not only support our children, but to support ourselves. There's a lot of self-care we need to do in order to make sure that we're prepared to show up for our children so that they feel seen and heard and soothed, as Emily spoke about. One of the things that came out of these conversations was that crisis, when you look at it, the two Chinese characters that make it up are danger and opportunity. And so if we think about those two things together, yes, COVID is a danger, but there are so many opportunities for us to capitalize upon, whether we be home with our children or have them online in a classroom. And so we as a school are going to look at the opportunities that we can offer to our kids and to you as well.
Thank you. A question about teachers becoming ill, and how will we replace them with substitutes for distance when we're in distance learning, and then when we're in person, and how we're introducing a new adult into a cohort in place of that teacher. Emily, would you go first?
Sure. So at the lower school, we've been really strategic in sort of creating layers before we would have to go outside of the Chandler community. So our teachers, of course, are the first line, and they have teaching assistants who are with them. And we're fortunate that our teaching assistants, having spoken with them this week, have a lot of flexibility, particularly in distance learning, to be in and out during the synchronous and asynchronous times. When we're in person, their schedule would be a bit more static, though we would be able to extend. So they would sort of be the second line. That would be the substitute teacher who would step in next. From that, a third layer would be some of our specialist teachers who are teaching remotely, even if we are on campus. You know, they're teaching from a hub space on campus. So they won't have had as much contact with other teachers or other kids and could possibly step in. And of course, an additional layer, you know, administration, we've all been teachers too. And I, of course, miss my days, probably more so than ever now, to be teaching kindergarten and first grade. That brings us a lot of joy, and we'd be happy to step in as well. We've also continued to cultivate relationships with subs who've been with us for a long time, and also use the company Scoot, which provides well-vetted subs to us and has done so before the pandemic and will continue to do so. So I think we have a number of layers of how we would introduce people, trying to maintain as much familiarity for students and people who are familiar with our program and procedures before going outside of the community.
As for the middle school, we have a fairly flexible schedule. So if we need to pivot from synchronous to asynchronous one day, we have the flexibility to do that. If it's a prolonged illness or something else that's preventing a teacher from working with live instruction from our students, I'm happy to step in for a short time period and then make the transition to the sub that will be taking over. So really just kind of providing that space where we can introduce somebody new for the kids to get acclimated to and warmed up to, and then they'll feel comfortable moving forward.
Thank you. Mr. Finch, a question about reopening, and when we do that, how much time will we be given, or parents be given notice to kind of transition from distance learning into in-person mode?
We hope as much as 2 weeks, but it could be as little as 3 days.
Thank you. And doctors, maybe you want to answer this a little bit. I could talk a little bit about the process of that we're implementing at school. It was a question about air filtration and fresh air being circulated in the classrooms. And we have in all of our classrooms upgraded all our HVAC systems to, I believe it's called MMR2 or 3, but they are upgraded, enhanced filters that are going to be in the classrooms. And we are also going to keep as many windows and doors open in all of our rooms, so that there is fresh air circulated. But Dr. Subramanian, do you want to add anything to that in terms of the science behind that?
Yes, those kinds of filters do make a difference. Ventilation is very important, but what's also important is how many people are there in the room. So the fact that we now have more classrooms, more distance between the children, and the fact that we have these new ventilatory plans in place, including some outside classrooms, are all very welcome and will help prevent the spread of this disease.
Great. Mr. Finch, in terms of a child developing symptoms while they're at school, can you talk a little bit about where that child will go and the process of getting, contacting the parent?
We've set aside an isolation room in the lower school, adjacent to where Lynn Westfall and Sandy Hume sit. And while a student waits there, we'll call parents, and the parents will come and pick up the child from the isolation room. And if we need another isolation room, then we have another isolation room we can put the child in.
And I just want to add about the filtration. We have MERV 13 filters is what we've installed that Jill just kind of told me. And Mr. Finch, a follow-up question to the isolation room or the wellness room is, will we have a nurse on site?
No, we won't. We're not hiring a nurse. We will be observing symptoms in our students, and that responsibility is a dispersed responsibility. So all of our faculty and staff will be trained in tracing, but also in our first aid, we learn how to identify symptoms. We also have access to numerous doctors within our community who we can call upon in a pinch if we need emergency help. So we haven't hired a nurse. We used our resources to hire more teachers to work with our students in the distance learning program and in the classrooms rather than hire a nurse. And we feel that that was an appropriate use of our additional resources.
Great. So I think, we're getting very close to the end of time here. And so I want to go ahead and close it up. I know that there may have been some questions that I did not get to, and there, and some of them were very grade level directed. And I think that during the grade level forums that we have next week, they will be answered much more efficiently during those opportunities and those spaces. So Mr. Finch, if you could close it. Thank you so much to Dr. Subramanian and Dr. Lin for joining us today. And thank you all for all your great questions. Mr. Finch?
Yeah, I just want to thank Dr. Subramanian and Dr. Lin again for joining us this evening. And thanks to all of our doctors in the medical task force who've been such an incredible help to the school throughout the summer and will continue to be available to us during the next few months, during the course of the pandemic. They're not going anywhere. And we're really fortunate to have them in our community. Of course, in addition to being doctors, they're Chandler parents. They have a deep connection to this community. And we treasure the connection we have with them. We appreciate the opportunity to use their expertise. I want to thank Jill and Emily and you, Joan, for being the moderator this evening. You've done a fantastic job. Somebody shared some data with me earlier this week, and that was that on July the 29th, there were 45 million children in the United States in pre-K through middle school. And 28 children have died of COVID nationally, ages 1 through 15, since the arrival of the pandemic. Of course, that's 28 too many. In 2016, 190 children died from the flu. So the common flu is 4 times as lethal for children as COVID. So we need to make sure that we have it in perspective. And we obviously, as Joe said at the beginning of his presentation, this is not going to go away anytime soon. So we have to live with it. And what we know is truly harmful for students, and there are good reasons why some students should stay at home. What's truly harmful for students is remaining at home. And we want to make sure that we provide every opportunity for those families who want their children to return to school to be able to do just that. Because video conferences cannot repair the damage that staying at home is doing to children. And we want them back in place with us. But we recognize that families are going to make individual choices about how best to handle the present circumstances. As we hear from the data, almost 75% of you are ready to come back at a moment's notice, and 20%, 19.23% haven't quite decided. 7% are comfortable at home right now, which is great. And I hope what you've heard from us this evening is that we're going to accommodate all of you in those choices. But we really do have a bias towards reopening, and we believe that we can do so safely, given the precautions that we've taken, the protocols that we've implemented, the training that we've undertaken. We're eager to have students back, should you choose to send them back to us. So we have some upcoming events next week that I just want to tell you about briefly. Jill and Emily will be hosting grade level forums to discuss the academic program specific to your child's needs. And then during the week of August 24th, the week after next, that's when class assignments and class schedules will be sent out. And then August the 27th and the 28th, there'll be supplies distributed. That'll be the car line pickup, and you'll receive more information about the specific times in an email that will go out tomorrow. And then in just under 3 weeks, it'll be the first day of school. And the 2020-2021 school year will begin, Chandler's 70th school year. So it'll be a memorable one, we're sure. And we're glad that you'll be undertaking it with us. So thanks for coming this evening. Thanks again to our panelists, and thank you for joining us. Thank you. Good night.
Thank you. Good night.